Hello, I'm Dr. Grace Young, obstetrician gynecologist and minimally invasive and robotic surgeon at Humber River Health in Toronto, Canada. Many patients are scared when their doctors recommend a GnRH Antagonist class of medication. However, many patients use this to effectively manage symptoms from their periods. I will answer commonly asked questions about antagonists. The brain sends signals to the ovaries to produce estrogen and progesterone. These hormones are what causes periods. We also know that having periods can make endometriosis worse. Antagonist class of medications blocks the hormone signal from the brain to the ovaries. This means less estrogen is produced in the body overall, which can lessen or even completely stop your periods. This can help with pain from periods, pelvic pain between periods, and heavy menstrual bleeding. In Canada, there are two types of antagonists. One is called elagolix, also known as Orilissa, and the second is relugolix, also known as Myfembree. Let's talk about elagolix. This medication is approved to treat endometriosis in Canada. There are two strengths, 150 milligrams once a day or 200 milligrams twice a day. Both doses each lower estrogen to a different level, and the pain relief and side effects you may experience may vary. Low levels of estrogen in the body can cause side effects typical to medical menopause, such as nausea, headaches, hot flushes, and mood changes. Sometimes these side effects can be made better by using add-back therapy, where we add back a small amount of estrogen and progesterone. However, most patients tolerate the medication very well. You must always weigh your symptom severity against medical side effects. Now, let's talk about relugolix. This antagonist is an estrogen reducer that brings estrogen to very low levels in the body. To prevent side effects of this medication already contains a small amount of estrogen and progesterone add-back. Relugolix is effective for treating endometriosis and heavy menstrual bleeding from fibroids. So how do you start the medication? Ideally, you should start at the beginning of your period or within the first 7 days after your period has started. However, these medications can really be started at any point in your menstrual cycle as long as you ensure that you are not pregnant. These pills must be taken every single day without a break. How long should I be on this medication? Endometriosis is a chronic condition, and your doctor may prescribe this medication for a longer period of time. As long as it's working for you, you can stay on it. However, it is important to protect your bones by ensuring you take 2,000 units of vitamin D every day and have enough calcium in your diet, as well as doing some weight-bearing exercise. Sometimes your doctor will order bone mineral density testing if you're on this medication long-term. These medications do not provide birth control, so ensure you have a form of birth control in place, such as condoms or an IUD. These medications can be expensive, but many drug plans provide coverage, and drug companies may provide partial assistance. Speak to your provider about options to help cover costs. The important take-home is that these medications are known to be effective and are temporary, reversible, and have no long-term impact on fertility.